Hi, I'm a psychiatrist in San Francisco with a mostly psychotherapy practice. I was a published psychotherapy researcher early in my career, and for decades I've taught psychiatry residents, that is, doctors specializing in psychiatry, about psychotherapy. This is the second video in a series I'm doing on psychodynamic psychotherapy. And today I'd like to focus on one of the most common reasons to seek psychotherapy, that is depression, and how psychodynamic therapy can help. I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. One of the most common reasons to seek psychotherapy is depression, a low mood, low energy state where you can't really enjoy life or anything about it. It goes on day after day, includes pessimism and hopelessness, often disturbance of sleep and appetite, trouble concentrating, and in more extreme cases, feeling like life isn't worth living and sometimes even feeling suicidal. There are many ways to treat depression, most of them laser focused on the symptom itself, the depression. Antidepressant medications, for example, can improve mood and concentration, sleep, and so forth. And in addition, there are psychotherapies, for example, cognitive behavioral therapy or CBT, similarly focused on improving depression specifically. CBT is based on the idea that replacing depressing thoughts with less depressing thoughts will improve the mood. And it's well established that antidepressants and CBT-like therapies are effective in relieving depression symptoms. So why consider psychodynamic therapy, aside from the fact that it's the most traditional and time-tested form of therapy? As discussed in a prior video, psychodynamic therapy takes a more global approach. It seeks to understand symptoms like depression in the context of the person's personality. It's based on the idea that depression is more than just sadness because of a loss. If you lose a loved one or have some other kind of loss, there will be sadness, but that's normal and gradually goes away by itself. It doesn't require any treatment. It's really a healthy response to loss. Instead, depression is being stuck in a low mood. According to psychoanalytic and psychodynamic thinking, this stuckness is psychological. It's your mind struggling with a conflict inside. You could say that it's your mind's best attempt, even though it's not particularly successful, at solving a problem. To illustrate that, we'll use Sigmund Freud's famous idea that depression is anger turned inward against the self. According to Freud, a depressed person holds a lot of anger inside without realizing it. For whatever reason, it's unacceptable to consciously be aware of that anger. Why? There are a lot of possible reasons. The anger may feel too powerful and destructive. The person's afraid of what would happen if that anger were let out. The anger may feel unwarranted, like the situation isn't bad enough to feel this much anger and that there's no justifying it. The person may feel guilty about harboring this much anger. They may feel they don't deserve to pass judgment on anyone else like that, and so forth. Note that all of these reasons reflect negatively on the person themselves. In essence, depression is self-punishment for having unacceptable angry feelings. Now, Freud wrote about this over a century ago, and the field did not stop in its tracks back then. We have other psychodynamic accounts for depression besides anger turned inward. Although I have to say that in my own practice, I've seen many patients where anger turned inward did seem to be the root of their depression, and having them talk about that and getting it out really relieved the depression. But other ideas include injured pride, what we call narcissistic injury, or damaged self-esteem owing to failure to live up to one's own expectations. The point is, there are a lot of psychological reasons that might underlie depression, and psychodynamic therapy aims to understand what's going on in one unique patient. Now, are these the only causes of depression? Certainly not. I've seen depressed folks who have depression for clearly biological reasons, a thyroid disorder, brain tumor, side effect of a medication, and many, many more who have depression for no discernible reason at all, the kinds of patients that most psychiatrists would think have depression for genetic reasons or for biological reasons, even though we don't actually understand any specific biological reason that people have depression. So I don't recommend psychodynamic therapy for everyone who has depression. And in fact, you should be suspicious of anyone who says there's one true way to approach anything. But many depressed people do seem to have a psychological need to stay depressed, to keep themselves down, to not enjoy life or let themselves fully live it. When that's the case, their psychology will resist. It'll do battle against those efforts to force the mood to improve. They'll fight the antidepressant, or they'll stop trying to replace their depressive thoughts with less depressive thoughts. They'll work against their own interest. In those cases, it takes a psychotherapy that tries to get underneath the manifest symptoms, the observable symptoms, to try to figure out what's at the root, what's causing them. Psychodynamic therapy and other so-called depth psychotherapy serves that function. Psychodynamic therapy is an insight-oriented, it aims for insight, uncovering psychotherapy. The ultimate example of that actually is psychoanalysis. But psychodynamic psychotherapy combines that with symptom-focused and supportive elements as well. I'm not going to tell you that psychodynamic treatment is the only treatment for depression or even that it's the best treatment. That depends on the patient. But this approach does offer something that most other approaches don't. Recognition that a person may psychologically resist feeling better. They may work against their own interests for reasons that they themselves may be unaware of. And in recognizing that, it's particularly suited for chronic, apparently personality-based depression, especially when it's accompanied by other signs of self-defeating and self-limiting behavior. Well, that's it for this time. Please share your thoughts in the comments below, and please like this video, but only if you really like it. Please subscribe if you have not already. And this video is part of a playlist I'm doing about psychodynamic psychotherapy, and this is a link to the playlist. Thanks, and I'll talk to you next time.